Hi Josh, how are you?
I'm doing well. How about yourself?
Good. I'm Daniel. I'll be your student physical therapist today. I'm going to get you started with your appointment, okay?
Okay.
Devin told me you've been having some issues with your hand, maybe dealing with some arthritis.
Yep.
Okay.
Been for a while.
Okay. So usually we like to try with patients with arthritis, we like to try to do some sort of heat treatment.
Mm-hmm.
And I thought that today would be a good opportunity for you to try out what's called our paraffin wax. So the wax helps us with patients with their hands and feet, just because the joints are really small and it's hard to get into all the cracks and crevices of the hands. The wax will be able to do that and get around all of your small joints and hands better than a heat pack would.
Okay.
Okay. With heat pack with heat treatments, they're really good for managing pain. They're able to open up blood vessels to help promote healing, and they're also able to relax muscles, relax joints, and really provide a nice relaxing therapeutic effect.
Okay.
And I think that would be really good for you. But before we do the treatment, I want to ask you just a few questions just to make sure this is safe for you. Sure. And the right treatment for you.
Okay.
Do you have any issues with blood circulation, whether it be blood being too thin or maybe having some clots?
Nope.
Okay. Do you have any issues with sensation? If I was to poke around your fingers, are you still feeling?
Yep, that's fine.
Okay. Are you seeing your doctor for any serious medical conditions?
Nope.
Okay. Any recent surgeries where they've had metal implants in your fingers or hand or wrist?
Nope.
Okay. Okay, all of those sound good. Again, with the heat treatment, it's really good for pain modulation, but there are some risks. And with the paraffin wax, the main thing we're worried about is burns.
Okay.
So going through this treatment, you should feel just nice warming sensation on your hand. You shouldn't feel any burning or any feeling that might make you uncomfortable, okay? If you do, let me know.
Okay.
As far as the paraffin wax goes, I double-checked the machine here with a warmer to make sure that it had a good temperature. The wax itself is hot, but it's mixed with a mineral oil and to bring like the temperature down so that it's safe to apply directly to your skin.
Okay.
So we should be okay. We should be okay there.
Okay.
As far as the process goes, what we're going to do is I'll have you use some hand sanitizer first, just to make sure your hands are clean. And then what we're going to do is you're going to dip with your fingers slightly spread apart and keeping them there. You're going to dip your hand until you're into the wax, until you're just below your wrist.
Mm-hmm.
Okay. And try to avoid touching the bottom as well as the sides because they're going to be hotter than the wax itself. Okay. We're just going to go in, hold it in there for a second, and then you'll pull it out for about 3 seconds so it can harden just a little bit. Then we'll dip back in.
Okay.
We want to do about 6 to 10 dips.
Okay.
Okay. After that, we'll come back over to the chair here. I'll have you sit down. I'm going to wrap your hand in this plastic wrap and then in a towel, just so we can insulate the heat and keep it contained, so we can really get the warming into your joints.
Okay.
Okay. We'll keep you wrapped for about 10 minutes. Then after that, pull everything off, and we'll be able to continue. Any questions about that?
Nope.
Okay. Are you okay doing the paraffin wax?
Yep.
Great. Okay. Let's do it. We'll go ahead and have you rub a little hand sanitizer in there.
Okay.
Okay, like I said, I'll have you maybe come and stand in the corner so it's not
Okay.
as awkward as of an angle. Yep. Fingers spread apart a little bit and just slowly dip into the wax until just below your wrist. You can curl your fingers to avoid touching the bottom if you need. Okay, try to get that thumb in there. Perfect. Okay, you can come slowly back out. Awesome. Just hold it for a few seconds, let it drip off and harden. Good. Okay, go ahead and go back in. Perfect. Awesome. That's 6. Let it hang out for just a second. Okay, and go back in. Wonderful. Come back out. Awesome. Okay, that's 10.
Okay.
Go ahead and kind of help guide you back to the seat here. Go ahead and sit down and put your hand in that plastic wrap. Perfect. I'm gonna wrap you up real fast. Plastic is more so just to protect our towels a little bit from getting covered in wax.
Okay.
But yeah. Okay. Get you covered up. Usually, you can lift your hand up just a little bit. Go like this. Lift your hand up one more time. Perfect. Okay, we're just gonna keep that in there. I'll be right here with you. Just, let me know if anything feels uncomfortable or is a burning sensation. Okay.
Okay.
Okay. Okay, we're about 5 minutes through the 10 minutes of keeping you insulated. How are you feeling?
Feels good.
Okay.
Still feels
No
warm.
burning or anything.
No, no burning.
Great. Okay. Okay. 10 minutes has gone by. We're going to unwrap you.
Okay.
How are you feeling?
Feels good.
Okay. I'm gonna take this plastic off. Okay, and then we can go ahead and have you stand up and walk back over here to the warmer.
Okay.
And we're actually just gonna peel this off.
Oh, okay.
So you can go ahead and help me if you'd like. And you can just drop it right back into the container. And then once we get all of this wax off, I'll go ahead and just for your sake to wash your hands again
Okay.
or use some hand sanitizer. Make sure you keep it not spreading any germs or anything. Make sure we get all the wax off here. Okay.
All right.
All right. Like I said, you can use some hand sanitizer or wash your hands. And we'll get going with the rest of your treatment. Okay.
Sounds good.
Okay.